Squamous cell carcinoma is the main neoplasia in cats, and it's probably 95+% of what we see. We've seen many neoplastic conditions, and one or two over my 25 years plus has been something other than squamous cell. So if you have an oral mass that's aggressive in a cat, it's almost always going to be that. If we can catch these when they're really early, which is unusual, we can do a lot to cure them. This is a referring veterinarian's cat that I see down in Punta Gorda, and we were doing a prophylaxis and oral evaluation with full mouth radiographs, and this cat had multiple areas of tooth resorption. We just noticed this little defect on the ventral portion of the tongue and biopsied it, and it was squamous cell. And so we got the cat back in next time we were there, and you can see here there's the area that we excised, and so we need to get good margins here. So we try to get at least 1 centimeter in all directions in order to hopefully remove everything. And that's what the excision area looked like. And there's the closure. And luckily, in this case, we got all of it, and we're about 3 years out, and we have not had a recurrence at this point. So if we catch these early, the better the prognosis. If they're rostral, the better the prognosis. If they're caudal, we're kind of behind the 8 ball immediately, no matter what size the lesion is. But we would at least, if we saw a small mass, say adjacent to a 4th premolar, we would certainly recommend excision, even though it's far back in the oral cavity. If it gets back in the tonsillar area, base of the tongue, and the caudal oral cavity, there's not much we can do other than possibly debulk if there's a physical hindrance to function, and then provide pain management from that point. But these are very bad from a prognosis standpoint unless they're caught really early. This is one that we would not be able to do anything for. This is sublingual, and it's already caused a significant amount of damage. Here's another view of it. So in order to even begin to attempt to excise this, we'd have to be back here pretty much taking the whole base of the tongue, which would not be good, not be functional. That kind of looks like vestibular bone expansion that we saw earlier. And you can get some vestibular bone expansion that looks close to that, and it's pretty significant. So if there's any question in your mind at all as to whether you're dealing with neoplasia or periodontal disease, you want to biopsy it. Now in this one, we had pretty significant change on one side. There's nothing on the other side, and usually that vestibular bone expansion is going to be bilateral in the maxillary canines. So that would be one clue that you would want to biopsy this. And then radiographically, when you see something that proliferative and destructive at the same time, so that you've got lysis plus you've got proliferation, you're pretty accurate in assessing that this is probably neoplastic, and this was. So that, in order to get margins on this, you've got to do this, which is not, cats don't tolerate that. So that would not even be a consideration.